Okay, you gotta let me catch my breath. Just ran from upstairs. Good evening, everyone. Good evening. And thank you for joining us this afternoon. I'll begin by thanking Lisa Rosenthal, the founder of the Vet Art Project. Pardon me. Still trying to catch my breath. For her great work with veterans and for agreeing to share this project with us today. I am out of shape. I'm out of shape.
5-minute break.
Okay. Is there a doctor in the house?
Yeah, we have a doctor.
Okay.
I'm not a real doctor.
Okay. The Commission on Human Relations Advisory Council on Veterans Affairs is committed to finding and supporting any program that will better the life of the veteran. So upon becoming aware of the Vet Arts Project, we asked Lisa to attend one of our council meetings and explain to the council how she was using the arts to improve the condition of the veteran. The Advisory Council was pleased and a bit intrigued by the concept, so as a representative of the council, I attended the sessions that was held right here. I was impressed with the professionalism of the Vet Art staff and the clear understanding that the Vet Art Project has the needs of our nation's veterans who have returned from combat is their first priority. The City of Chicago Commission on Human Relations Advisory Council on Veterans Affairs and the Vet Art Project is joined today to give you an opportunity to learn of the workings of the Vet Art Project and to hear from mental health care professionals their thoughts of using the arts as a tool in therapy, and from the veterans themselves that are participating in the Vet Art Project. I'll turn this program over to the founder of the Vet Art Project, Lisa Rosenthal, who will introduce today's panel's participants and guide you through today's program. Thank you.
Hi, I'm Lisa. Welcome. I want to begin today by sharing with you the mission statement for the Vet Art Project. The Vet Art Project creates opportunities for veterans and their family members to work in collaboration with artists from all disciplines to create new art about war and service in public performance and viewing. The goals of the Vet Art Project are to support our veterans, create stronger voices among our veterans, provide new opportunities for artists, and offer a venue to hear the voices of our veterans and family members and foster discussions about how war and service affect us all. I created the project in 2007, and it's built on building connections within the community. It's about building community among civilians, veterans, and active duty, and it's about building compassion through understanding. This is not a place, the Vet Art Project, whenever we do programmings, there is no judgment, there's no politics, just art. I wanted to begin today by telling you a little bit about the timeline of the Vet Art Project. I wanted to tell you things like, I created this project in September of '07, and since then, we've done a variety of performances and programs that have numbered more than 30, that we've worked with over 100 veterans probably in this time, and we've worked with probably 100 artists by this time. We've done a number of performances too. In fact, we were just at DeKalb for our first campus-based Vet Art project at NIU, and J.D. Kamas will be speaking to you shortly. So I wanted to give you numbers that reflect what the Vet Art Project is about. But instead of telling you that, I want to tell you about the story of one young veteran, a National Guardsman, who participated in our project just this past weekend. He came to us, he had a story he wanted to share. It was going to be shared through visual art. That didn't work out. We collected his story, and we worked together to shape it, and we presented it. One of the veterans who served with him in the same, at the same naval base in Iraq presented the story in performance. And this young veteran who shared this story with us had never talked to his wife about just about anything that had happened to him in Iraq. She attended this performance, and she witnessed this story. And I just spoke with him before I came here this evening, and he said they have been talking a lot about his experiences. So I can't think of a better way to introduce the Vet Art Project to you and what it is that we do than that story. This afternoon, we have a beautiful and assorted panel of professionals and participants in the Vet Art Project. I'm very pleased that they're all here to share with you. Eric Prozier from the Jesse Brown VA Medical Center. You'll hear from each of them in turn. Jan Johnston, who is a psychologist who has worked with the project. David Fagan, who is a clinical consultant with the Vet Art Project also. He also went with us to NIU. He will also co-lead the Witnessing Veteran Stories workshop with me tomorrow night. Mike Helbing, an artist and also the chair of the National Veterans Art Museum here in town. J.D. Kamas, the president of the NIU Veterans Club at NIU. Adam Navarro-Lowry, who is also a participant of the Vet Art Project and is involved with the veterans community here in Chicago in many ways, which you can read in the bio that was on your chair. Matt Ping is an artist, a veteran of the war in Afghanistan, and he is currently a student at the School of the Art Institute. He is a multifaceted, talented artist who has shared his art with us and with the community since February. Bob Curry is the founder of dryhooch.org from Milwaukee. He has not only been a participant in the project, but he is the founder of an organization that connects veterans to veterans, providing counseling and community services and drug and alcohol discussions and community. Sue Ellen Simakoski is on the faculty of the School of the Art Institute, and she is also a participant in the Vet Art Project, has led a number of workshops for us, and is a creative arts therapist. So please help me in welcoming the panelists today. And I asked each of them to begin today by sharing one story of a personal experience that they have where they can show how art has helped in the service of a veteran. So Eric?
Thank you. I'm a psychologist at Jesse Brown VA Medical Center, and I provide outreach and readjustment services to veterans coming back from Iraq and Afghanistan. And I just wanted first by saying it, in the now classic Trauma and Recovery by Judith Herman, Marty Horowitz, a California psychologist, is quoted by saying that trauma is that which we can't integrate into our life script. With that being said, trauma becomes these holes that are mirrored in our bodies and our thoughts and our interpersonal relationships. And talk therapy can have its limits on addressing these holes. And one of the programs that I put together, I call it Battle Body Training, is using kind of mind-body and creative interventions to address these holes. And on Monday, I have a creative expressive therapist that's co-leading the group. She's a creative dance movement therapist. And I had a few veterans in the group, and we started off by expressing, having people check in with their body language and wherever they were. And the one veteran that's coming to my mind, he stands up. He's a Iraq veteran with PTSD and severe readjustment difficulties.